I know medical research is not what you were expecting, but let me explain. When we were working on HealthKit, we talked to a lot of medical experts, and the conversation often turned to research and some of the challenges they face in a process that really hasn't changed in decades, and we thought we could help. One of the biggest challenges researchers have is recruiting. They often have to pay people to participate, which, by the way, doesn't give you the best cross-section of the population. But the bigger issue is small sample sizes, sometimes 50 to 100 people, which limits our understanding of diseases. Another issue is subjective data. The most common way to assess Parkinson's is to have a patient walk in front of a physician, and the physician rates them on a scale of 0 to 4. I think that's a 2. Yet another issue is the frequency of data. Researchers often get snapshots of data through time, like that quarterly trip to the doctor's office. But we all know that the reality is disease symptoms ebb and flow daily and sometimes hourly. But perhaps the most significant challenge is the communication flow. When you participate in a study, you often don't hear back until the very end of the study, if at all. We looked at these problems and we saw an opportunity to help. There are hundreds of millions of iPhone users out there, many of whom would gladly contribute if it were just easier to do so. So today, we're proud to announce ResearchKit. ResearchKit is a software framework made specifically for medical research. It lets researchers easily create apps, and it turns iPhone and HealthKit into powerful diagnostic tools. Now, we didn't build it on our own. We've been working with experts from these institutions for the past year, and together we've built the first 5 apps, each targeted at some of the world's most serious diseases. Let me give you an example. Parkinson's. We worked with the University of Rochester, Chunhua Hospital, and Sage Bionetworks to create Empower. Now, anyone with an iPhone can contribute to Parkinson's research. It's easy to sign up. You just do it right on the phone. And the app turns iPhone into a diagnostic tool. Let me give you an example. There's a quick tapping test that evaluates hand tremors. Or you can say "ah" into the microphone, and the processor will detect minute vocal cord variations that assesses the level of Parkinson's. And remember that walk test? Now all you have to do is stick your iPhone in your pocket, walk out 20 steps and back, and the accelerometer and gyroscope precisely measure gait. And you can do that anywhere, not just in the doctor's office. Thanks, guys. The app also pulls data from HealthKit, like your activity data, from your Apple Watch, from your iPhone, or other devices. Researchers believe that exercise can affect the symptoms of Parkinson's, but some believe that exercise may actually slow or even halt the progression of Parkinson's. And now researchers get a chance to look at that data. But here's the best part. The user sees this right on his or her phone, empowering them to understand and possibly influence their health long before a research study is concluded. So that's just Parkinson's. For diabetes, we worked with Mass General on an app that looks at behavior and glucose levels. For cardiovascular disease, we've worked with Stanford Medicine and the University of Oxford on an app that looks at heart health. For asthma, we've worked with Mount Sinai on an app that the purpose of this is to see if a mobile app can help a patient manage their asthma. Now, this one's available throughout the US, but they're doing something really neat in New York City in phase 2. Mount Sinai is giving away some spirometers and Bluetooth inhalers for data accuracy. And then they've teamed up with Cornell Medical College, and they're actually swabbing city surfaces throughout New York City to look for pathogens. And then the iPhone, the GPS coordinates from the iPhone, will compare to exacerbations from the spirometer data, and then map that to the pathogen map and try to tie all of that together to understand what the triggers are for asthma. That's just cool. And for breast cancer, there's been amazing progress in the treatment of breast cancer over the past couple of decades. And as a result, there are more and more survivors who often suffer with symptoms post-treatment that are not well understood. So this app is targeted at all of those brave women, hoping to help them live a better day. Now, let's talk about something really, really important. There is nothing more sensitive than your medical data. You decide what apps you participate in, what research you participate in. You decide how your data is shared, and Apple will not see your data. We're